know why I'm always telling you that it's worth speculating in relatively unknown small-cap biotech stocks. Just take one look at the performance of BioDelivery Sciences International, BDSI, which is a drug delivery play. The company uses a proprietary drug delivery platform where you stick a little film on the inside of your cheek and it dissolves, allowing for the rapid delivery of drugs for time-sensitive conditions or for medications that don't work as well if you try to digest them. Mainly, the company's focusing right now on developing treatments for pain management and drug addiction, which I think is brilliant. It's a brilliant setup because painkillers are exactly the kind of drugs people get addicted to. We know the concept works because BDSI already has one drug on the market, a soluble film version of fentanyl. That's for cancer patients who unfortunately have breakthrough pain. Now, this is a tiny $650 million company, so small that I'm begging you not to go near it in after-hours trading. Don't think about buying it without using a limit order. I don't want you to get hurt. Even though you need to be very careful about buying these small-cap names, they can be very rewarding. BDSI has rallied 187% in the last 12 months. It's up 128% year-to-date. It's gained 81% past 3 months. Heck, it's up 12% since the beginning of the week, courtesy of some positive Phase 3 data on one of their leading painkiller drug candidates. This kind of stock's not for the faint of heart, but anything that's nearly tripled in the course of a year deserves a closer look. So let's check in with Dr. Mark Sirgo. He's the president and CEO of BioDelivery Sciences International. To learn more about his company and where it is headed. Dr. Sirgo, welcome to Mad Money. Good to see you, sir. Have a seat.
Thank you, Jim.
First, this announcement this week is pretty breakthrough. There's millions of people who are addicted. Millions. And I see the numbers just for oxycodone alone. People are still taking it. They're giving this drug out billions of dollars worth each year. It's a mistake, isn't it?
Well, the drugs are certainly effective. Opioids are here to stay. There aren't very many products that work as well as opioids for the treatment of chronic pain. So they're here to stay. The question is, how can we better get physicians to recognize patients that might be at risk for abuse and addiction? And that's a challenge, but it certainly can be overcome. But
do people know about your product? Because to me, your product, as soon as it's approved, the one for cancer, yes, but
right.
This just seems like that people may not even know about it, that the doctors aren't familiar with it.
You're right, they aren't. I mean, buprenorphine is a unique opioid. We say it's just not another opioid because it's classified as a C3 opioid by DEA, which means that it's less abusable and less addiction potential than the class 2 opioids, which are all the other ones that you could think of, such as oxycodone, morphine, and fentanyl. So this is what we like to think of as a safer alternative if you're going to use an opioid.
Okay, well, for instance, I had some tough surgery today. Oh. And as soon as you get out of the surgery, they give you, this is the standard, they give you 40 Vicodins. Okay, I don't want to take Vicodin. I don't want to take Oxycontin. I don't take any of these. I don't want to take them because I fear I am at risk. Would I be able to say to my doctor, look, I think I am at risk. Can I have this cheek bandage?
Absolutely.
And there'll be a standard?
Let me explain to you the difference between these C2 opioids and buprenorphine.
Yes,
buprenorphine is what they call a mixed mu agonist antagonist. All the other opioids are a pure mu agonist. So pharmacologically, it's different.
Okay.
Yeah, it's still an opioid. But the biggest difference is that it has a very low propensity to cause euphoria. And it's the euphoria that drives these patients' cravings. And the cravings lead to the addiction and the abuse. So if you can limit the propensity to cause the euphoria, you start to see the opportunity behind a product that contains buprenorphine. And that's the big difference here.
Okay, so where are you with partners to be able to get the word out and get this drug distributed worldwide?
Well, we've got a great partner on this product. It's Endo
Endo
Pharmaceuticals,
yeah.
Right, one of the leaders in the pain space. So behind them, I mean, we've got a ways to go here yet. We got 2 positive Phase 3 trials. Hopefully get the NDA submitted by the end of this year. It'll be a 12-month review, or 10-month review cycle by FDA. So hopefully by the end of next year, the product may be nearing availability.
Now, I know because I see a lot of publicity on the regular news stations about how this addiction is probably the fastest growing, this oxycodone, fastest growing addiction in the world. Does the FDA feel the need to maybe get this thing going a little faster?
Well, we'd like to think that, but we don't have any indication of that as of yet. We'll have a pre-NDA meeting coming up in the next several weeks, and of course, it's all in the data. So the NDA goes in towards the end of the year, as I mentioned, and then they'll make the decision on whether they think this is an approvable asset or not.
In the little time we have left, topical clonidine for painful diabetic neuropathy. I mean, this has got to be another thing that the doctors want very badly.
Right. A topical treatment for painful diabetic neuropathy does not exist. So again, it's all oral agents that have a heavy side effect burden, drug interaction burden here, a topical administration of a product that has no systemic absorption, so you avoid side effects, drug interactions, and you can use it in combination with all those other products.
Well, I don't want to hype it, obviously, because the stock's moved up a lot, but when I hear about what you're doing, I'm thinking, and I know how bad the addiction is, believe me, I think this is an amazing, amazing delivery system you have, and I hope you have the best success.
Well, thank you very much.
Absolutely. That's Dr. Mark Sirgo, President and CEO of BioDelivery Sciences. Again, it's up a lot, but you understand why it's up a lot, because it fulfills a major need that's a hole in the whole medical system worldwide. Mad Money's back after the break.